So a cavity is basically a deterioration of your tooth structure, usually the enamel and also other surfaces that are beneath the enamel that create, as we say, sometimes they cause a cavitation or little holes on your teeth. And so those are what cavities are. So how can you recognize that you actually do have a cavity? You can recognize it by looking at it, by seeing it. Sometimes basically you can't really tell because they can develop in areas where you can't really see them. And that's the reason why a dentist will come into play as far as diagnosing, different types of cavities. But sometimes you can see like some darkening of your tooth structure. You can your tooth. You can see some areas that may be white in colors, and that can be surprising, but that can start the cavity process, and usually or many times on smooth surfaces. So that means just like on maybe like the outside of your teeth or the inside of your teeth area where there are no grooves. You can see those white spots. Sometimes white spots are not cavities, but sometimes that's visually, right? But you can also sense that you have cavities. For example, when you eat something sweet and you have pain, that can signal that you have a cavity. When you drink something cold or hot and you have pain, yes, that usually signal that you have cavity. And obviously as well, visually, you can see big holes, for sure that you have a cavity. So what should you do to prevent, first of all, cavities? So number one thing is you want to definitely be very cautious and very meticulous about your oral hygiene, because that would be one of the main reasons why you may have cavities or develop cavities, because you're not brushing your teeth properly, you're not flossing your teeth, and also you're not having regular or routine checkups at the dentist. And so I told you what you may not do. So what you need to do is to make sure that you're brushing your teeth at least twice a day. You want to aim the toothbrush in a 45-degree angle, so lodging the bristles of the toothbrush between your gum and your teeth in a sweeping away motion. So you're going to be sweeping as well the bristles of the toothbrush away from the gum surfaces. That will ensure that you're actually removing food debris and bacteria that get lodged between your gum and also between your teeth. Okay, so that's number one. You want to make sure that you do that at least twice a day, morning and night. Don't forget the night, because at night we have less salivary flow, or you produce less saliva. That is going to help you as far as preventing or making it hard for bacteria to actually adhere to your teeth and starting to eat at your teeth. Okay, now another thing that you need to do is make sure that you are flossing between your teeth, because the bristles of the toothbrush are too thick. Even though they're so small, they're too thick and they don't really reach the areas between your teeth. So it's kind of like, those little areas, those little crevices between, or the space between maybe a fridge and the countertop. Yeah, those areas, you can't really reach them very well just with a broom. It's hard to reach, right? So that's the same thing. You want to make sure that you're flossing in a C motion. So you're going to hug the surface of the tooth with the floss that you actually want to clean. And then after that, when you're done with that surface, you're going to hug the other side for the other tooth. So you're going to do that, and that's going to help you as far as removing surfaces, debris between your teeth. Because there are many times where we see people, they do a good job at brushing their teeth, but when you take the radiograph, which is the reason why I had told you earlier that sometimes you can't really see, there's some areas that you cannot see with your naked eye. We can't see them with our naked eyes as well. That's the reason why you have to take x-rays, and with the x-rays we're able to tell that you have cavities between your teeth. And believe it or not, there's some people, as I was trying to say, they have very good oral hygiene as far as brushing on the outside surfaces of the teeth, but where their lag is, or where they're not doing a good job, is at flossing, and that can cause them to actually develop interproximal cavities or cavities between the teeth. You also want to, on a routine basis, go to your dentist so that you can have good cleaning at least every 6 months. That way we are removing the very hard tartar or calculus, the hard plaque that gets caked on your teeth and that are very difficult for you to remove. We have special instruments to actually remove them, and that's going to help you. Okay. So that's what I wanted to talk to you about today. I'm Dr. Valerie with Healing Wings Dental, the place where we help our patients maintain and regain their oral health and their smile so that they can soar in life. You can come to us. You can give us a call, 972-213-0202. We'll be happy to become a part of your oral health journey. Okay. And we are located at 4101 West Quinault Boulevard, suite number 317 in Arlington, Texas. That being said, I am excited to see you next week for another talk about how to take care of your teeth or your oral health. Take care. Bye-bye and be blessed.